Hello, everyone. Thank you for joining today's webinar, Understanding Potential Menthol Tobacco Bans and Their Impact on Communities of Color. I'm Kate Sullivan-Hare, Vice President for Policy and Communications at the Alliance for Health Policy. For those who are not familiar with the Alliance, welcome. We are a nonpartisan resource for the policy community dedicated to advancing knowledge and understanding of health policy issues. The Alliance for Health Policy gratefully acknowledges Robert Wood Johnson Foundation for supporting today's webinar. I'm pleased to turn it over to Dr. Avenel Joseph, Vice President of Policy at the Robert Wood Johnson Foundation, for some opening remarks.
Welcome to the Alliance for Health Policy's webinar on the impact of menthol tobacco. My name is Avenel Joseph, and I am the Vice President for Policy at the Robert Wood Johnson Foundation. The Robert Wood Johnson Foundation is the nation's largest philanthropy dedicated to improving health and healthcare. We've spent significant time over the past 15 years raising awareness of the fact that health is profoundly shaped by who you are, where you live, and how much money you make. We are committed to challenging systemic barriers and surfacing solutions that will remake the United States in the name of health equity. Black, Latino, Indigenous, and LGBTQI communities have long faced inequities that have limited their opportunities for health. And for Black Americans, these inequities have been exacerbated by decades of targeting by the tobacco industry. It's no accident that nearly 9 in 10 Black smokers use menthol cigarettes, which are easier to smoke and harder to quit. And each year, approximately 45,000 Black Americans die as a result of smoking. Earlier this year, the FDA announced it would issue proposals to ban menthol cigarettes and flavored cigars. Today, we will hear from tobacco control experts about the disparate impact of menthol tobacco products, especially on communities of color. And we'll learn more about the opportunities and challenges of implementing the FDA's forthcoming menthol bans. Public health outcomes are not just about the choices individuals make, but about the choices available to people in any community. We hope the FDA will act swiftly to save countless lives and advance health equity in our country. Thank you.
Now we'll go over some quick housekeeping items and then introduce our moderator and panelists. I want to remind everyone that you can join today's conversation on Twitter using the hashtag AllHealthLive and join our community at All Health Policy, as well as on Facebook and LinkedIn. We want you all to be active participants, so please get your questions ready. You should see a dashboard on the right side of your web browser that has a speech bubble icon with a question mark. You can use that icon to submit questions you have for the panelists at any time. We will collect these and address them during the broadcast. You can also chat any technical issues you may be experiencing, and someone will attempt to help. Please be sure to check out our website, allhealthpolicy.org, where you can find background materials, including a resource list and an expert list. A recording of today's webinar, including today's slide deck, will be made available on our website soon. So here with me today to explore a potential menthol cigarette ban is an esteemed group of experts. I am so pleased to be joined by Carol Magruder, founding member and co-chair of the African American Tobacco Control Leadership Council. Ms. Magruder is a seasoned veteran of California's tobacco control experience and has served as an advisor in many capacities. In 2010, Ms. Magruder was honored with the Martin Luther King Jr. Civic Engagement Award for her tobacco control work in San Francisco. Next, I am pleased to introduce Joelle Lester, who directs Public Health Law Center's commercial tobacco control work, leading a team of 20 attorneys and policy analysts working to support tobacco control policy change throughout the United States. The center does this by providing legal, technical assistance to public health professionals and advocates, developing resources on the most effective legal policy measures to reduce legal and policy measures to reduce the burden of disease and death caused by tobacco use in the United States. Finally, we have Matthew Myers, president of the Campaign for Tobacco-Free Kids. In 1996, Mr. Myers helped to found the campaign and has been with the campaign since its inception. Initially, he served as its executive vice president and legal counsel and oversaw the campaign's legal and advocacy efforts. We're going to launch today's discussion hearing from Carol, who will provide a brief look why this topic is relevant, as well as outlining disparate impact of the use of modern tobacco products on various populations. Carol, I'll turn it over to you.
Hello, everyone. I'm trying to populate my camera. Okay, there I am. Hello. So I'm Carol Magruder, and I'm a founding member and a very proud co-chair of the African American Leadership Council. Next slide, please. Next slide. Our group, we are based in California, but we have impacted and helped to set the priorities for tobacco control, commercial tobacco control in the United States, founded in 2008, and we're kind of the last African-American tobacco control advocates standing after some budgetary cuts and constraints in California. And we have been working ever since on this issue amongst many others. Next slide, please. So we filed a lawsuit last year against the FDA because of their lack of action on the issue of menthol, which they were mandated to do. Next slide. Next slide, and then advance. Yes, so our co-plaintiffs in the lawsuit it's us, the Action on Smoking and Health, the American Medical Association, and the National Medical Association. And the National Medical Association is African American doctors who formed their own association when they were not allowed into the AMA at the time. But we've all been working together, and the AMA actually helped to bring in the NMA. So we do have our America's doctors are standing with us on this issue. Next slide, please. So because of that lawsuit, and I know Matt and Joel are going to talk about this more in depth, but because of our lawsuit, that prompted the FDA not to act on our lawsuit, but to act on a citizen's petition that had been filed many years ago as well. And so they've committed to taking menthol, to making a proposed rule to take menthol and little cigars and cigarillos off the market, which were left in the original Tobacco Control Act at the time. Next slide, please. So at the time when President Obama, seems like a century ago, signed the Family Smoking Prevention and Tobacco Control Act, all flavors except menthol were taken out of combustible cigarettes. And it was generally accepted that flavors hook children. And so we've seen no more demonstration of that than with the epidemic of teen vaping in our country that swept our country right under the noses of adults and parents. And we see the power of these flavors. But menthol is the mother lode of all flavors. Next slide. So the initial exclusion of menthol from the banned flavors was not based on science. It was based on a negotiation. And so African Americans aren't the only people that smoke mentholated cigarettes, but because of the pernicious targeting, 80 or 90% of Black smokers smoke mentholated tobacco products. And so we called this trickle-down public health policy, where the public health policies are made really to protect the people who have more agency and more time to deal with the issues in their community. And then it kind of trickles down to the communities and the people who need it the most. Next slide. So at the time when menthol was excluded was exempted as a banned flavor, our community asked, who will protect our children? Who will protect Black children? Next slide. Who will protect these children? Next slide. Who will protect these young people? Because African American smokers are not born whole as adults with a Newport cigarette in their mouths. We go through the same processes and the same issues as all people do as we attempt to grow up past adolescence and young adulthood. And so we want a fair and level playing field so that Black children have a chance to get through the minefield of youth and adolescence and come out on the other side as a non-addicted adult. Next slide. Yeah, thank you. And so this is an abstract that was actually submitted at the World Conference in Singapore some years ago. And it documents, it's called The Least of These. So U.S. tobacco control policies, mentholated cigarettes, and African Americans. And so in my culture, the people who are at the bottom are the least of these, and we consider ourselves to be that many times with public health policy. And this abstract just documents how all of the major tobacco companies perniciously targeted the African American community. They had urban programs. They co-opted our Black leadership groups. They infiltrated our media. Our magazines that we love and respected, Ebony and Jet, were just full of Newport ads. They had free giveaways to children, van programs. And this, because of this pernicious targeting, the legacy of that today in 2021 is that over 80% of African Americans who smoke a mentholated cigarette. Over 90% of Black youth initiate with menthol. And as we've seen with the opioid epidemic, addiction is about science and opportunity. It's not about some particular people in our society are just going to become addicted to products. And so the tobacco industry had access to our population. And so we look at menthol as a human rights and a social justice issue. Next slide. This is the poster girl for that the programs of the 70s. This is Marie Evans. She's an inner city youth, and that's a code for Black youth. She grew up in Boston public housing. She was given free Newport cigarettes at age 9, addicted to cigarettes at 13, dead at 54. And her son was able to successfully sue and was awarded $152 million by a Boston jury that looked at the evidence and decided that the value of a Black woman's life in Boston was worth $152 million. And some of that was punitive. And the family actually settled for $79 million. Next slide. So this is Dave Chappelle. Most of you know him. He's a very famous comedian. He was given free cigarettes at the age of 14 in the metro station in Washington, D.C. And that's how he began his life as an addicted smoker. Next slide. This is a picture that we found of him when he was 18. And when he talks about this, he talks about how young he looks, so that he was obviously a child and underage. But the practices of the industry were to distribute these products in our community to our children, to Black children. And we're living the legacy of that every day. Next slide. So because of the inaction of the FDA on this issue, local municipalities begin to act to protect their youth. The first one was Chicago under Mayor Rahm Emanuel in 2013, and he simply created a buffer zone, a 500-foot radius where these products could not be sold. In a city like Chicago that's very dense, of course, that took a lot of these tobacco retailers offline. The tobacco industry promptly sued. They litigated, Chicago litigated, they prevailed, and that opened the door for all you see today with all of the local municipalities and states coming online to say, we don't want these deadly products in our communities. So between 2013 and 2017, there were a lot of municipalities and cities along the way who enacted variations of that. But San Francisco in 2017 became the first major city to take menthol and flavored tobacco products offline, so that at this point in San Francisco, you cannot buy a pack of Newport cigarettes. And I'm from San Francisco. This woman who did this legislation represents the district that I grew up in. And as a teenager, I bused myself to a better high school. So I rode past all of the liquor stores and all of the tobacco outlets in my neighborhood out to the avenues in San Francisco where there were no such outlets. And so I personally have lived this and have seen what these retailers and the inundation of these products does to a community. Next slide. So in California in 2020, California became the second state to enact a statewide ban on the sale of these products after Massachusetts. And this was our virtual signing with Governor Gavin Newsom. And so this was a hard fight. And so next slide, please. And the tobacco industry pulled out all the, they pulled out all the cards. So they actually engaged some African American leaders to say that we were discriminating against Black smokers when we were protecting Black smokers. And so to confuse the issue. So this is actually a march during COVID organized in Los Angeles by people who received tobacco industry dollars to say that Senate Bill 793, which was the law to take these products off the market, was discriminatory against Blacks. Next slide. This is in Sacramento, the day of the vote, and this is near an area where there are lots of homeless people. And the industry actually paid Black smokers to come and testify that we needed our menthol cigarettes and that it would be racist to take them off the market. Next slide. So African Americans are used as a tool to blunt public health policy for everybody. In our country, we're having a reckoning right now around race. And so, this should be a health issue. It should not be a racial issue. Canada, the European Union, they've taken these products offline, and there's no discussion about the racial implications of taking a deadly product offline. But in our country, because of the pernicious targeting of the industry, it's the exact opposite. Next slide. So the tobacco industry uses the legitimate concerns of the African American community to block public health policies that will save Black lives. They use racism, police brutality, and officer-involved killings to say that taking these products offline will create a Black market. It will increase officer-involved interactions with Black people, particularly Black men, as Eric Gardner in New York City is a prime example of that. And so it offends us that the industry has used racialized targeting of African Americans, and now they're flipping it to say that to take these products off is racist. Next slide. So this is an issue of social injustice for us. The tobacco industry targets everyone, but they're particularly pernicious in our community, and we have so many other issues to deal with. And so the tobacco control gets pushed to the back burner, even though it's killing 45,000 Black people every year and is the largest killer, killing more than gun violence, homicides, other forms of cancer that are not related to tobacco combined. So this is a major issue for our community, and one that has been, until these last few years, kind of silent because we have so many other issues to deal with. Next slide. This is PAVE, and these are my sisters, and I'm actually proud to be on an advisory board member for PAVE. So PAVE is Parents Against Vaping, and this is just to contrast the difference in the response, the public response and outcry for what's been happening in African Americans for decades, and what happened when the vaping industry went after America's youth. So these mothers started PAVE. It's a national organization now. Next slide. They were able to get hearings on the Hill, and if you look there in the left-hand corner, you'll see myself and Dr. Valerie Yerger. They were able to call on the carpet the practices of these companies that have targeted our children and have so many teenagers now and young adults addicted to vaping. Next slide. And they were able to get a settlement already from Juul, $40 million for North Carolina, one of many states that will be paying, that Juul will be paying. And yet there has been no reparations or no specific addressment of these issues for African Americans. We're still out here with, you know, in the past 20 years, 1 million Black people have died from mentholated tobacco products, which are easy to start and they're harder to quit. And they numb your lungs so that you can inhale the toxic chemicals deeper into your lungs. They dilate the alveoli and the lungs. There are many things that you know, they say there's no difference, but there's a big difference between mentholated and non-mentholated tobacco products. Next slide. So in fact, we are asking to be a protected class from the industry. We deserve that, and that's part of our plea as we move forward. But we want the FDA to take these products off the market. And so we think that there's enough evidence out here. There's no reason to wait any longer. And we would like action. Next slide. And so that's the end of my piece of this. Thank you.
Thank you so much for that helpful context. It really is truly very powerful to see this all laid out here like that. Now I'm going to turn it over to Joelle.
Joelle, you have yourself muted.
Can you hear me now?
Yes, we can.
Yes. Okay, I'm so sorry about that. So I'm just going to add some policy change details to the really important context that Carol provided. And I just want to also point out that Carol is really one of the founders and leaders of the movement for menthol policy change in the country. You're really hearing from someone who's been at the forefront of this fight the entire time. So really applaud Carol and her colleagues at the African American Tobacco Control Leadership Council for all of their good work that's gotten us to this point. So to talk about state and local menthol policy change, first we have to put it in the federal context. Next slide, please. So as Carol mentioned, when President Obama signed the Family Smoking Prevention and Tobacco Control Act into law, it prohibited flavored cigarettes but exempted menthol from that flavor restriction. Next slide. And so much of the advocacy in the first few years after the passage of the act and the establishment of the FDA Center for Tobacco Products focused on trying to get the FDA to add menthol to the list of prohibited flavors in cigarettes. As Carol said, menthol is the most harmful and most widely used flavor in cigarette. It has more particular harms and making it easier to start and harder to quit. And it's a dramatic driver of health disparities, both for the African-American community, first and foremost, but also the LGBT community and others. So we filed a citizen petition that Carol mentioned in 2013, along with 18 other organizations. And this is a photo of myself with Dr. Valerie Yerger and Doug Blanke delivering that petition to the FDA. And we have continued to push the FDA to act. But until April 29th, there wasn't a very meaningful response to the citizen petition or to all of our efforts to press the FDA to act, because it has plenty of evidence and all the authority it needs to get menthol cigarettes and other menthol tobacco products off the market. Next slide. So when we weren't making progress at the FDA, we turned our attention to state and local policy change. So there were actually a couple of flavor restrictions early on that exempted menthol that followed the bad practice of the Tobacco Control Act, made the same mistake, New York City and Providence, Rhode Island. But they were important because they were litigated on the same legal issues that menthol would be litigated on later, and the cities prevailed. As Carol mentioned, Chicago was the first local jurisdiction to include menthol in its flavored tobacco product restriction, which was incredibly important and confirmed through that litigation that menthol doesn't need to be treated differently than other flavors in sales restrictions. San Francisco had the first most comprehensive policy, all flavors, all products, all retailers. And then I just include Duluth, Minnesota to show you that it's not only big liberal cities on a coast that are interested in protecting health and advancing health equity by addressing the problem of menthol. Many communities have done so. Next slide. So this is just to give you a little snapshot of how many communities there are very active states. So you can see Massachusetts, not all of those include menthol, and they should, and hopefully they're going back and adding those in. California and Minnesota are probably the most active, with so many jurisdictions getting menthol off the market. And then a lot of big cities even outside those states. Next slide. As Carol also mentioned, there are 2 states that address flavored tobacco products, including menthol, through statewide legislation, which is, of course, extremely important and delivers the health benefit and the health equity advancement to all corners of the state. Massachusetts was the first one. That law is in effect. It has a very narrow exemption, but otherwise prohibits the sale of flavored tobacco products, including menthol and e-cigarettes. California's law has a few more exemptions and has not yet taken effect. The tobacco industry's response has been very aggressive to the California legislation. They gathered enough signatures to send it to a vote at the ballot, the statewide ballot, and then have also sued in federal court. So the current status of that legislation is pending the outcome of the ballot measure. Next slide. I also want to add that tribal governments have been active in addressing menthol and other flavors in e-cigarettes. This was largely in response initially to the e-cigarette lung vaping injuries, which seemed like this huge epidemic right before the actual pandemic, but it was very harmful and concerning. And tribal governments have the authority to do a lot to protect health in their communities, and they have been. And so I just want to make sure we're always including tribes as one of the jurisdictions and policymakers that can act to protect health and reduce the disparities driven by tobacco product use. Next slide. I mentioned litigation earlier. This has been a really big part of policy change in the menthol context, flavors generally, but menthol in particular. The industry does not want to let go of flavors in tobacco products. It is key to their success in attracting and addicting new tobacco product users. Both New York City and Providence, Rhode Island were sued, as I mentioned. Carol mentioned Chicago's litigation. Massachusetts communities have been sued over how they determine which products are flavored. The city of San Francisco had theirs referred to a citywide ballot measure, which the advocates won. Public health prevailed. And then I mentioned that California's is pending. So I think what we can take from this is the tobacco industry really doesn't want these menthol inclusive flavor restrictions to take effect. It's going to be a big blow to their business model, which is one of the ways we know it's going to be very effective to protect health. Next slide, please. So this, just the state and local policy change context fits into the larger and very important federal context. So I'll turn it over to Matt to talk about the FDA.
Thank you. And yes, if we could have Matt Myers join us, we look forward to hearing from you. Thank you, Joelle.
Thank you. It's my pleasure to be here. And my pleasure to be here with two of my partners who have worked with us on these issues across the country and over the decades. So it's incredibly important. I wanted to start with this slide because as important as the state and local action is, and it has been the driver of change, we need to realize that unless we have a national solution, there will be portions of our country where African Americans and other people of color simply won't be protected. So next slide, please. That makes the time we're in right now particularly unique. We do, in fact, have a unique opportunity today that we haven't previously had. We have a confluence of factors, a concern about health equity, unlike anything we've seen in our country in years past, a president and an administration that is deeply committed to these issues. And fortunately, this is an issue that doesn't depend upon Congress coming together and reaching a solution. The 2009 Act, while it didn't directly deal with the menthol issue, did in fact give FDA the authority on its own to address these issues. So it's a critical factor there that this is one of the social problems that we have, where we not only have a solution, we have an agency with the authority to act on its own if it has the political will to do so. And we come together at a critical juncture because as both Joelle and Carol have noted, on April 29th, the US Food and Drug Administration announced its intention to advance a product standard to, in fact, eliminate menthol cigarettes, but need to look at the wording very carefully. What they say is they've announced a product standard where they're going to work towards issuing a proposed standard. That makes this time for all of us particularly important to understand, because it's not what's happened, but what has to happen going forward for whether or not the hope and promise of finally tackling menthol becomes the reality. Next slide. Next slide, please. What we need to excuse me, go back one slide. I just missed that you've done it. We need to understand this isn't the first time we've had the opportunity, but it is the most important opportunity we had. Congress in 2009 did instruct FDA to act quickly. It told it to immediately convene a Tobacco Science Advisory Committee to study the issue and make recommendations. It told that committee that it had to act within a year. Next slide. The Tobacco Science Advisory Committee at FDA did its job. In July 2011, it found that the scientific evidence demonstrated that the removal of menthol cigarettes from the marketplace would benefit the public health in the United States. The FDA then conducted its own study and reached an identical finding with regard to it. So at the time that the petition that Joelle and Carol referenced was filed, we were already primed. FDA had made the scientific findings that were necessary. But the critical lesson for our current moment is they made the scientific finding, but didn't act for purely political purposes. Next slide, please. 4 years later, we had another opportunity. In 2017, then Commissioner Scott Gottlieb announced his intention to issue a regulation to eliminate the sale of menthol cigarettes. And in fact, in March of 2018, he issued an advance notice of proposed rulemaking. But once again, the process stalled out. And it didn't stall out because of a lack of scientific evidence. It stalled out because of a lack of political will on behalf of the administration. Next slide. Which brings us to where we are today. And the critical place of where we are today is both Carol and Joelle commented. Two things are obvious. One is menthol cigarettes create an unprecedented harm to our most vulnerable communities, particularly people of color, and have had a devastating impact solely because of the tobacco industry's marketing to these communities. And second, the scientific evidence is now clear, unequivocal, and substantial. There is no scientific reason for FDA not to act. So let's talk about what the next steps are and why what we do as a community is absolutely critical. First, FDA said it would act within a year. What does that mean? It means it will issue a notice of proposed rule. That's a notice of proposed rule within a year. But a year is a very long time. We need to make sure our voices are heard to say to FDA and to the public, there is no need to wait for a year. You have been studying this issue for over a decade. It is time to move and time to move now. Our voices need to be clear, sustained, and unequivocal on that. Second, once FDA finally issues its notice of proposed rule, that is the start of the process, not the finish of the process. By law, FDA has to ask for public comments. Traditionally, public comments are a minimum of 60 days, normally at least 90 days, and in this case, could well be longer. During that period of time, everybody concerned about this issue across the board needs to make sure that we do two things. One is that we submit detailed scientific comments that outline the reasons and support for banning menthol cigarettes. And two, we need to push FDA to move rapidly to review those comments, because we know the tobacco industry will do as they have done before, submit literally hundreds of thousands of comments, in large part just to delay the process. So it's important that our voices be heard in two ways. Demand that FDA prioritize this and move quickly. And second, provide FDA the scientific and public support to do so quickly. We also need to be ready for the arguments that we know they'll make, even though they have no merit. They will argue that menthol does not make the product more toxic. They will bring out their old bugaboo that claims that a ban on menthol cigarettes will create a black market. I should tell you, they claim that whatever tobacco control measure we ever do. They'll claim that our country doesn't have the resources to help smokers quit. We need to address that issue directly. And lastly, amazingly, even in 2021, they will claim that menthol does not lead to more smokers or more death, despite all the evidence to the contrary. Next slide, please. What that means is that what we do going forward is the most important thing that can happen. We need to participate in the FDA process. I know the FDA process appears opaque, but it needs to be subject to public input, scientific input, and community input. We need to engage in the process. We need to remind FDA every day why it's so important to act and to act quickly. We also need to understand something else, that the tobacco industry will try to get Congress to intervene with FDA. So we need to make sure that members of Congress understand that they should not intervene. They should let FDA do the job. And those who care about the health of our communities within Congress need to speak up. Lastly, once FDA issues a rule, the likelihood is that the tobacco industry will sue. In any event, the rule by law can't take effect for within a year. And during that period of time, we have to expect the tobacco industry to sue. Again, we have a role to play at that juncture. We need to encourage the FDA to move swiftly to oppose the litigation, and we need to lend our voices to that litigation, just as AATCLC and others have done in the lawsuit that's currently pending, in order to make clear to the court that FDA had more than enough scientific evidence to move, and that there is more than enough political support to justify that. We need to engage. We have started a process. We have a unique opportunity. But what we do, not just over the next 6 months, but over the next couple of years, will be critical to whether this hope turns into reality. Thank you.
Great. Thank you so much, Matt. I'd like to turn this over now to the audience for their questions. Remember, you can use the questions panel of the audience interface to submit your questions at any time. And now, while questions populate in the queue, I want to start with a few opening questions to our panelists. Some of you touched on this in your opening remarks, but we've gotten a few questions already. So we'd like to dig in a little bit deeper. How effective are bans? Have they been successful with other tobacco products at the state level or in other countries? And I'll welcome any or all of your
Let me
responses.
jump in pretty quickly with a couple of things. One is Canada has already banned the sale of menthol cigarettes. And what they found was it didn't lead to a significant black market. It did lead to a dramatic increase to the number of individuals who previously smoked menthol cigarettes in quitting altogether. So the net public health gain was substantial and real. What we've also seen is that, as Carol began, we know that flavors hook kids. Close to 50% of all kids who start smoking in the United States across the board start with menthol cigarettes. The elimination of the availability of those products will have the most dramatic impact on reducing the number of young kids who start and provide us the tools to work with communities across the country to help people quit. The public health gain's been measured. A study out of the University of Michigan talked about the potential impact in terms of literally hundreds of thousands of lives and healthcare costs saved.
And I'd like to go on, Joelle.
Oh, no, you go, Carol.
What I want to say is that the rush to measure whether these bans are effective, which at best, it's been a few years, so we've had decades of this predatory activity, and now we pass a law. The law is the beginning of the change, not a magic bullet or solution. Mm-hmm. And there are many things that need to accompany the law, which include cessation services for people to get off of these addictive products, and us pulling together a comprehensive package to support this process. So to look at these bans and say, well, do they work? Well, we really haven't had time to see what the effect is. And there was a study out of San Francisco that was flawed because they started to measure whether youth had stopped vaping or smoking before the law actually took place, before they had actually taken the products off the shelves. So, there are lots of speculation, but we know that these products have killed 1 million people, Black people, in the past 20 years. So let's move forward and let's make it work. If there's tweaking that needs to be done in the future, then let's do that.
That was part of what I was going to say, Carol, and I would also just add that the FDA has a lot of authority to adopt companion policies and to robustly implement and enforce its pre-market review authority. Matt referred to illicit trade, which is always, as Matt also said, was something the industry always throws up whenever there's a strong public health policy proposed. And the FDA also has tools that it is not deploying to deal with that issue. So for example, the FDA is supposed to implement a track and trace program to make it easier to track the tobacco products and reduce an illicit market, and they haven't done that. So we're asking the FDA to do all of these things, as well as get menthol cigarettes off the market. And I will say the citizen petition that we filed in 2013 also called on the FDA to ramp up cessation services and supports that would both help people quit and reduce any demand for an illicit market.
And that's exactly what I wanted to get to next, is we did have a question. What supports are possible to facilitate cessation by those who now prefer flavored products? What can be ready to go? What interventions are more comprehensive? And is there still funding to direct such efforts?
It's a great question, Kate.
Yeah.
A couple things. One is there are significant cessation services already available. But as we work on this policy, it's going to be important that states and communities do better outreach than they have ever done before to make sure that people know what services are available. Second, many of us are supporting legislation in Congress to expand cessation coverage for everybody on Medicaid and to fund programs to make sure that everybody on Medicaid is made aware of the availability of those services and the products that are have been approved by FDA to assist smokers to quit. A critical thing to understand is that the United States Preventive Health Services Task Force has on several occasions looked at e-cigarettes and found that the evidence is inadequate, including the menthol e-cigarettes, to conclude that they are a safe and effective way to help people quit. So what we need to do is use those tools that we have and the services that we have to assist smokers. We need to make a nationwide commitment. We're going to help every smoker quit. And we can do that if we have the political commitment to do so.
And we also need to shift how we categorize smoking. We have a cessation chair, Dr. Karen Beard, and we want smoking to be seen, and nicotine addiction to be seen as a chronic disease. When people have diabetes, when they have high blood pressure, you don't give them one intervention, and if it doesn't work, you say, okay, too bad for you. So if you get a nicotine patch and you don't stop smoking, you know, that's it for you for this year or next year. We need to embrace this issue. It's a chronic disease. And the money that we would save as a nation, if we can get and have innovation on cessation, we're stagnant. There have been so little innovation with cessation. So, you know, we just sent 2 men out into space this past week. So let's put our intention and our focus on creating better cessation strategies and solutions to liberate the millions of Americans who are addicted and slaves to these products that are killing them.
I would just add, even that, you know, I wouldn't say it's even an accurate characterization to say anyone prefers flavored products. The products are addictive. They are addicted to these products, and they are addicted because the products are pushed on communities. And so I think I agree wholeheartedly with Carol that we need to approach this as helping people free themselves from addiction. And think about it as meeting the medical needs of the addicted, targeted smokers, remembering that they were children when they started, and really reject the idea that there's a free choice to be made when addiction is at the heart of something. I would just add that one of the, that's an industry talking point, and one of the resources included in the handout today is actually an ACLU letter that was essentially a combination of industry talking points also. So I think you have to be very careful and questioning when you see something that says Black people like this product more. As Carol said, this is a product pushed on the Black community. Adults prefer a menthol product. That is just accepting the industry's view that these products are bring pleasure and are chosen, which they bring harm, health devastation, and it's an addiction.
I just had a question from an audience member. What is it that makes tobacco more addictive with menthol for people of color? I guess I imagine it's for anybody, but what is it about menthol that makes the tobacco
menthol is an anesthetic, so it numbs your throat. So that initial smoking where your body would just reject it, that menthol helps to numb that. It dilates the lungs, the alveoli, so that the toxins go deeper into the lungs and people can hold the smoke in longer. It masks when people start to have symptoms from smoking. It masks those symptoms. You know, Black men, when they go in with lung cancer, it's stage 4, they're dead. They're, you know, and that's another issue. And that was one of the things that Dr. Phil Gardner, our other co-chair, when he was seeing how we die so much more, and there's a lot wrapped into that because we don't have access to health care. You know, there are many things that go into this equation, but the menthol cigarette is one of the vectors that we can control, and we can make sure that not another generation of my children, of your children, are going to be addicted to these products. And as adults, you know, we're telling the young people, resist, you know, resist the media, resist the marketing. It's our job to protect our children so they don't have to go through a minefield to get to the other side. It's our job as adults, as thinking people, as agency for our people to take that off the table, so they don't have to endure that. I mean, when we punish children who are addicted to e-cigarettes now, we should be punishing ourselves because that happened on our watch. We didn't know what, you know, the social marketing, the influencers, all our kids are addicted now, and now we want to kick them out of school because they're addicted to a product when they need treatment, you know. So that's on the adults of our country.
Okay, you know, there have been studies. It's been well known for over a decade, and there have been an increasing number of studies that document exactly how nicotine interacts with the brain when delivered through a menthol cigarette in a more powerful, more rapid way. So that the studies show that menthol smokers of all demographics who try to quit have a more difficult time to do it. It's not a particular subsection or a particular group. It's anybody who is addicted to menthol smokers. The data shows clearly they try to quit at or above the same rates as non-menthol smokers, but they don't succeed. And it's not because that they aren't strong-willed, it's because of the chemical interaction of menthol that combines with tobacco smoke that creates a more powerful addiction than it does even with cigarettes.
Thank you. I've had a question about some state efforts, and specifically, do the letters from state attorneys general asking the FDA to ban menthol help? And how many state AGs have acted, if anyone happens to know?
There were 23 state AGs who signed the initial letter. At least one other signed a subsequent letter with regard to it. It's hard to know what impact that has within FDA. Our hope is that, in fact, FDA will take those things very seriously. In addition, I guess most people don't realize, but when the state of North Carolina settled its lawsuit against Juul a couple of weeks ago, later that afternoon, the Attorney General of North Carolina wrote to FDA and said, you need to take all flavored tobacco products off the market. It's not something that we as a state are in a position to do. So the voices have been consistent, science-based, and strong, that they need FDA to take action. Our hope is that this FDA will listen.
I think also the AGs have been important because they can very authoritatively address the issue or the specter of an illicit market. And they are the ones who are doing a lot of the enforcement and compliance in their states. They know a lot about illicit markets, and they address that in the letter that they sent to the FDA. And I think that's really important to have those voices added to the debate rather than sort of this red herring argument only from the industry.
And it's my understanding that North Carolina, their settlement with Juul is allowing Juul to leave menthol vapes, menthol e-cigarettes on the market there in North Carolina. So I would encourage the other attorney generals that are still negotiating with Juul to not allow that to happen, to make them take menthol off. These cigarettes, these vaping products, they have not been approved by the FDA as cessation. There is a big switch, and Juul is really trying to make a move on the African American community. They donated $7.5 million to Meharry College, one of the few African American medical institutions and colleges. And so we know that the shift will be to our community. So these products have not been proven to be good for cessation. Most people are dual users, and Juul, their nicotine level in the US is twice that of Juul products that are sold in Israel and in Europe. So African Americans who have high blood pressure, diabetes, we know that nicotine constricts the blood vessels and increases the blood flow. That's a recipe for cardiovascular disease, strokes, heart attacks. And so we want our people to stop. We don't want them to switch. We don't want to make Newport customers lifelong Juul customers. We want a healthy, vibrant Black community, and we deserve that as others do.
Mm-hmm. We've had some questions from folks who they must be from the DC area, where you saw this recently go through the DC City Council. And there was a bit of a, some other stakeholders spoke up. I just wanted to ask, what are some of the potential effects on other stakeholders, particularly potential revenue shift or loss with local businesses? And go ahead.
You know, it's a great question. First of all, one needs to understand that money not spent on products that kill you still gets spent. So that if there actually isn't a revenue loss, there's a revenue shift. And the reality is that virtually every other consumer product that people would use that money for provides more resources into the community, not fewer resources. Second, I think if you're a retailer and you're counting on products that addict and kill young people for your market, you ought to rethink your marketing model.
Amen.
To be perfectly honest with you with regard to it. But the reality is that we have seen is that in states and communities that have tackled these problems, retailers haven't been hurt. And in fact, overall government revenue hasn't gone down. So the revenue loss is a red herring. There's another thing that's really important, and coming out of COVID, it couldn't be more true, transparent. And that is, we're ignoring, when you talk about revenue loss, the healthcare costs that this community is suffering. There is an immediate benefit to the community from people who quit, from young people who don't become addicted. We see it in quick healthcare costs in terms of pregnancy and cardiovascular disease, long-term over chronic disease. So that for the District of Columbia, and we hope this week that the mayor will sign the legislation, the actual net impact will be a significant financial benefit, not a loss.
Okay, well, we look forward to seeing a good economic benefit in DC then, hopefully, if the mayor does sign the legislation. I have another question about protected classes. In countering or addressing the black market argument, how do you ensure that Black and brown communities are not, in a de facto sense, targeted and profiled should certain individuals participate in buying and selling of cigarettes? Can you all say more about what it would mean in practical terms if African Americans were deemed a protected class?
Well, the protected class that we're talking about would be, we want some type of remedy for this targeting that we have experienced. And we're actually, what the tobacco industry has done to the African American community is in violation of a treaty that's called the International Convention for the Elimination of All Forms of Racial Discrimination. Their predatory racial targeting of our community violates that treaty. And we're in the process of taking that to the UN, of sending in letters, and you'll be hearing more about that. But with regards to the targeting of African Americans, this is something, you know, our country must deal with police reform. And this is an issue that the AATCLC, we are front and center on. I had extra slides, I had to take them out because there wasn't enough time. But what the FDA is proposing to do is on the manufacturing level. So these products will not be produced anymore, so there will be nothing to smuggle. And maybe they're going to go bring something in from Europe, you know, and those issues we will handle as they happen. But the FDA law that's being proposed is not about the individual smoker. It's not about, there's no one in San Francisco, the places where we pass legislation, there's no one that's going to come up to a smoker and say, a police officer, are you smoking a menthol or a non-mentholated cigarette? It is not about the individual. It is about the manufacturer. It's about the retailers. And so, and we're working to, in California, for example, we're working with the Attorney General's office. We're working with the police chief of San Francisco stood with us at our press conference there, taking these products off. And so just as we need to reckon with these issues, the cigarettes have nothing to do with the police reform that we need to happen in our country. And so with public health, we're approaching that from both angles, and we must. You know, there are people who've been, Amadou Diallo in New York was standing on his stoop when he was killed by the police. You know, Eric Gardner was allegedly selling a single cigarette because of the high taxes. So these are issues that we face. We're at a reckoning in America. So let's reckon, you know, let's reckon. But we're not going to leave these deadly products out there killing more people than all these other things combined while we get this thing together.
You know, and Kate, I think all of our communities are concerned about that issue. You know, so the DC legislation, for example, is explicit. The law is not to be enforced against individuals. It's not to be enforced by the police. So that we will eliminate that issue. Eliminating menthol cigarettes is a social justice issue. Only the tobacco industry could try to twist it in such a way to turn it around. The reality is, the social justice is that African Americans are dying at higher rates of lung cancer, heart disease, diabetes, and chronic bronchitis, not because of anything they've done, but because of decades of industry targeting. 50 years ago, fewer than 5% of African Americans smoked menthol cigarettes. The tobacco industry saw that as a target and targeted that community with devastating consequences. What we're doing is saying, no longer can you get away with that. And precisely because we share those concerns, every one of our organizations, every time we work on legislation, ensures that the enforcement is against retailers and manufacturers, not against individuals, and that there are explicit provisions to protect against police abuse.
Okay. I do have a follow-up question for Joelle. What are the opportunities and challenges of states creating laws and regulations around tobacco versus the federal government?
Oh, that's a good question. I think that, you know, states and locals have some authority that the federal government doesn't have. So for example, use restrictions like smoke-free laws or tobacco-free laws are, that's an authority only states and locals have, not the federal government. And then the federal government has some authority that the states don't have, specifically related to tobacco product standards, like removing menthol from cigarettes and other tobacco products. I think that the challenges are similar but different scale. The industry is very engaged in trying to kill effective commercial tobacco restrictions at every level of government. So they do that by lobbying, they do that by suing, they do that by trying to repeal at the ballot. They are willing to spend obscene amounts of money to attack both an individual state or local policy and to intimidate and chill similar policy change from happening in other jurisdictions. But I think that the flip side of this is it's going to take all levels of government thinking big and bold and comprehensively to solve this problem and end the commercial tobacco epidemic. That the FDA's authority and reach cannot be left on the table. We need the FDA to get menthol cigarettes and menthol tobacco products in general off the market in every community in the United States, including those where they don't have the political will to enact a more local policy. We need the FDA to handle internet sales, because jurisdictions at the state or local level can try, but the FDA can handle the whole problem in a more comprehensive way. Illicit trade as well. But
Right.
States and locals have always led the way. The states are, the locals especially, are the ones who change how we think about what's possible. And that has been true in every area of commercial tobacco, and that's true on menthol too. The FDA is very late to this game, and if it weren't for the local policy change led by Carol and others, we wouldn't even be at a point where a federal regulation was possible.
Well, I appreciate your response there, and it's clear what needs to happen next then. I want to thank all of you for your insights on this important topic. This is all the time we have for today. Well, I doubt if this is going to be the last time we hear about this, but I want to thank all of our panelists for joining us this afternoon. We are thrilled to share that our new health policy handbook has been issued, and we would like you to visit our website for a straightforward and unbiased guide to the basics of health policy. Also, please join us on July 27th from noon to 1 for a webinar covering dual eligibility. And then on July 29th, also from noon to 1 for a webinar on rare disease. Please take time to complete the brief evaluation survey that you'll receive immediately after the broadcast ends, as well as via email later today. We really value your comments. We read them out loud to each other, so please leave us a comment. A recording of this webinar and additional materials will be available on the Alliance's website. Carol, Joelle, and Matt, please, thank you very much for joining us today.
Thank you. And our website is savingblacklives.org. I neglected to mention that. And thank you so much. This has been great. Thank you.
Thank you.